Hello, my name is Ariel Carter. This is going to be my skin, hair, and nails assessment. My patient today that I have is CW. Hello, CW. How are you today?
Good.
Great. Today we're going to be performing a hair, nails, and skin assessment. And this is going to be a basic assessment of me inspecting your skin, your hair, and your nails. But before we do that, I actually want to ask you a series of questions that involves these things. So firstly, any past history of skin disease?
No.
Great. Any changes in your skin, color, or pigmentation that you've noticed?
No.
Any changes in your moles, like if you seen like the color or the shape change, or any bleeding or excessive itching from your moles?
No.
Any excessive itching you've noticed occurring on your skin?
No.
Any bruising?
No.
Okay, great. Any rashes or lesions you've noted?
No.
Okay. Have you had any recent hair loss?
No.
Great. Um, what about the temperature of your skin? Have you noticed any over dryness or over excessive moisture?
No.
Okay. What about during the different seasons in the winter or in the summer? Have you noticed the skin temperature?
No.
Okay. Um, what about your nails? Have you noticed any changes in your nails? The shape of it, the color, brittleness?
No.
Okay. Any exposure to environmental hazards that you're around that may affect or actually cause your skin to uh, have any of those things, like lesions or rashes?
No.
Okay. Um, tell me how you take care of your skin.
I wash
Okay, what kind of do you use, like perfume soap, mild soap?
mild.
Okay, do you moisturize your body once you get out the shower or out the tub?
Yes.
Okay, what do you use to moisturize your body with?
Neither.
Neva. Okay, any oils or anything like
Baby
that?
oil.
Okay, great. It's really important that you keep your skin moisturized because dry skin actually causes you to itch. And when you itch, you want to scratch your skin. And sometimes when you scratch, sometimes you can break your barrier. And your skin is actually your first line of defense. It's your biggest organ, and it protects you from a lot of things like infection. So it's important that you keep your skin moisturized so you don't itch a lot. And then that causes scratching. So now that we're done with the actual subjective information from you, I'm going to do an assessment. And first, we're just going to start with your skin. So we'll just go to the parts where they're actually exposed. So I'm going to start actually with her arms. And I'm just going to look at her arms to make sure there isn't any lesions or moles or any rashes that I notice, or any different color pigmentation on her skin that's different from the rest of her skin type. And her arms look great. We'll just go to the back. I'll just look down the shirt here. Everything looks great. So there is actually no lesions or anything that I've noted on her skin. Her color is great. She does have small freckles here in her face along her nose line and around her eyes a little bit, really small. The temperature of her skin is nice, warm, and dry. No excessive dryness or any over moisturized. So that's great. The texture of her skin is nice, smooth, and firm. The thickness of her skin. Her skin is actually thin all the way around. Too much thickness can uh, great. Any edema. There is no edema. Usually you'll see edema in your hands. You'll see sometimes dependent edema in your upper extremities. And then also the number one spot for edema will actually be in her lower legs. And as I'm looking down here, she doesn't have any edema at all. But you did tell me previously that you have hypertension. And usually, people with hypertension, you will see edema in their extremities, especially their lower extremities. But Her ankles look great. There's no edema in her lower extremities or her upper extremities, which is great. The mobility and turgor of her skin. So right now, what I'm going to do is check the elasticity of her skin. And what we're going to do is go right under her clavicle right here. And what I'm going to do is actually just pinch her skin. And when I pinch her skin and let go, it should retract and recoil back to its normal state. And it does. And this just determines your elasticity of your skin. Usually in older people, you won't see that. It'll take a little while for their skin to actually recoil back to its natural state. And that's because they use a lot of collagen and fibers that actually make their skin elastic. But your elasticity is great. So that's good there. There's no bruising that I've noticed on her skin, no varicose veins. So everything looks great there. No lesions noted. So now I'm going to actually inspect her hair. And what I'm going to inspect her hair for is actually just to make sure that she doesn't have any baldness or any spots, that her hair is uniform all the way around, and her hair is actually smooth, it's straight, it's shiny because of the natural oils that we produce in our hair. It's distributed all around. I don't see any patches or anything. And as I'm feeling her scalp, I don't feel any lesions or anything there either. Everything looks great. And then also, you'll see fine hairs on your extremities, like on your arms, really fine. And then you'll also find some underneath your armpits, in your peri area, and then also on your legs, you'll see fine hair. But most of your hair will definitely be on your scalp, on top of your head. So everything looks great there. So now we're going to inspect your nails. And so when we inspect your nails, what I'm looking for is to make sure, first of all, they're clean, because this actually determines your hygiene and your self-care. Her nails are clean. Her nail beds are great. They're square. Her nails are not brittle. They're actually firm and nice, and they're uniformed all the way around for the thickness. And that goes for both hands. And then also when you inspect the nails, you also want to check for circulation. A good way to check for circulation is for capillary refill. And what that does is, all you do is, I'm going to press down on your nail bed here. It's going to turn white. As soon as I release, it should turn pink, which it does. Her capillary refill is actually immediate, which means you have good circulation. And you can also do the same thing in your feet as well. You can take a toe and check for capillary refill that, and that'll help you determine your circulation in your lower extremities. So that's great. The color of her nails is translucent. There isn't any colors or blotches in her nails, which is great. So that's pretty much it for that. Your skin looks good. Your hair is good. I don't see any abnormal findings. Your hair also in your nails look great as well. So one thing I do want to actually teach you is how to determine if there is any abnormal findings you may see, or you can possibly see. And what you can do this is by doing a skin self-assessment on yourself every month. And this will be a great thing to do when you do your self-breast check. So it's pretty simple. And the first thing I do want to tell you is, say if you have any moles and you see any changes, what you can do is called the ABCDE assessment. And what that does, it helps you to determine if there's any changes in your moles. And if you see any of these changes, you need to contact your primary physician, so they know, and you just know that it's an abnormal finding. So what we need to do is, A means asymmetry. And that means if you have any moles that's asymmetrical, then that's abnormal.
What about this one?
This one right there, this one is actually fine. It's symmetrical here. She actually has a mole here. It's symmetrical. The color is brown. There isn't any abnormal color there. And it is not It doesn't have a hump or anything, so it looks fine. When you start seeing it being irregular with ragged edges or irregularities around the surface of it, then that may be a potential problem. But and then, how long has the mold been there?
Since I've been born, I guess.
Has there been any changes to the mold since? No. Okay, so that's great. Any changes? So if this mold been there since you've been born and there hasn't been any changes, then that's been good. But if you start to see any colors, any different colors or any irregularities, then that's when you need to contact your primary physician and get it checked out. But if it's being constant, then it's not a problem. Okay. So what we now need to do is actually do the skin self assessment, and it's really simple. You just have to you can do this like before you get out the shower or before you go to the shower or when you out the shower. It doesn't matter. You just need to have all your clothes off and you need to have a body mirror. And what you're going to do is just inspect your skin. And what you're going to do is stand in front of the mirror. First, you're going to do your inner arms. Look at your palms, look at the back of your hands. Just inspect your skin, make sure there's not anything there that you didn't notice before. Any lesions, rashes, anything like that. And then once you inspect this, you're going to look in the mirror. You're going to go to these, your arms here and your elbows. And just check that in the mirror. Do the same thing. Inspect for any rashes or any abnormalities there. And then after that, you're just going to stand and do a whole frontal view. From your face all the way down to your leg, to the top of your feet. Just look down and make sure that there's nothing, any abnormal findings there. Then you're going to turn to your right side, check the lateral part of your right side, check the lateral part of your left side. And then you're going to turn around and actually look behind you. And when you do this, you make sure that you look to the right side and also to the left side and just look down your back. And then you're going to take like a small handheld mirror if you have one of those at home. And then you're going to look at the top, the back of your neck and down your back. So you can get that area as well. And then once you do that, you're going to take a chair and look at the soles of your feet to make sure there's not anything there. Usually you won't get a rash or anything on the soles of your feet, but you probably see any moles or maybe a lesion or something there that you didn't notice before. So you want to inspect that as well too. So this is something that you should try to do every month so that you can notice anything or any problem so that they can be taken care of right away. So did you understand that? Do you have any questions about that self-check, skin self-check?
Not at this time.
Okay, great. So do you have any questions or concerns for me regarding your skin, hair, nails, anything that you want to bring to my attention?
No.
Okay, great. So there's no questions. That means you verbalize that you understand the teaching.
Yes.
Okay, great. So this has been my skin, hair, nails assessment. Thank you for your time. See you soon.